Hi everyone, I'm Maliha, a licensed mental health counselor who loves sharing information about mental health. When we think about navigating the realm of psychiatric medication, it can seem very overwhelming. So today I invited Dr. Saba Maroof, who is a psychiatrist in the Detroit area, to help shed some light on this topic. Thank you so much for joining us, Dr. Maroof.
Oh, thank you so much, Maliha. Thank you so much for the invitation, inviting me. I'm so excited. I love your page and all the work that you're doing.
Something that was on my mind was that a lot of my patients talk about feeling overwhelmed when they think about all the different types of psychiatric medications that are out there. And some of them have actually tried quite a few different ones, and they feel like they just haven't found the right fit for them.
So it can be overwhelming. Definitely, it's really important to kind of have a good relationship with your psychiatrist and kind of have be open to communication. Most psychiatrists are open to talking about medication issues. If there's a big issue, then they want to hear from their patients. I know that I do. I don't necessarily want a patient to go like 2 months or 6 weeks even with side effects or any problems with their medication. So I always invite my patients to please contact me even in between appointments so we can work on things. Maybe I'll squeeze you in and make an appointment earlier. And we should be spending a lot of time on really looking at the diagnosis even. It's really not proper practice to just give a medication for certain symptoms. You really want to look at the whole diagnosis, just like you do in therapy as well. It's really important to hone in on a diagnosis. And there's other things that we take into account. We actually also ask about family history, number one, to help with the diagnosis. And also, sometimes there can be some genetic factors, psychogenetic factors we call them, and that can kind of help you pick the right medication too. If there's somebody in your family that was on a certain medication, then it might actually, that same medication can help you as well. Some ethnic groups actually have different levels of enzymes that are what are metabolizing these medications, and they might be more prone to side effects. So for example, when I have maybe like an individual of South Asian background, then I kind of know off the bat they might be a little bit more sensitive to medication. So I'm going to start at a lower dose and go up. Keep track of the medications that you've tried and also the doses and how long you've been on them. That really helps me to kind of figure out where to go from next. Like if I'm seeing somebody for the first time that's tried a few things, that's what I'm spending some of the time, the first hour that I see them, kind of help trying to go over that history. And most of us follow what we call like an algorithm. Like if this doesn't work, then let's try this class, or we're not going to try like 5 medications with the same mechanism. That might not necessarily make sense. But definitely kind of be open and communicative with your physician, with your psychiatrist about that. The other thing is that many times it's primary care physicians that are managing, especially depression and anxiety, and that's totally fine. Our primary care colleagues, oftentimes they're seeing a bulk of patients because it can be harder to access psychiatrists. Oftentimes they're really well versed in definitely in treating depression and anxiety. But when it gets to the point when you've tried a few different things, then they also might refer you to see a psychiatrist, because that's our specialty.
I think a lot of people feel disheartened if they don't find the right fit, or let's say they've tried the medication and for the first week or so, they're using it as prescribed, but they dip in their mood, or maybe they feel loss of energy, or they're feeling very exhausted.
Most of the medications that we prescribe are going to be taken every single day, and most of them take time. So it's going to take more than a few days, and sometimes you have to keep taking it even if it doesn't work. And then if it's been a few weeks, then we might bump up the dose. Sometimes you will experience some side effects in the beginning, and I try to educate my patients on kind of what to expect the first few weeks. For example, for pretty much all the antidepressants, you can have some stomach upset in the beginning, but that does resolve over time. If it's been going on for weeks and weeks, then we say, okay, maybe there's something going on, maybe this isn't the right medication for you. But the first few days, even week or so, you might have some stomach upset, but that does go away. If it's making you tired, talk to your doctor about it. But oftentimes I'll tell people some of our medications, it's better to take them in the morning, but if you feel like it's making you tired, then you can switch it to bedtime. So there is kind of a lot of flexibility. There is a small subset of patients that have tried all different types of medication. Nothing seems to work, and we do have other options for them as well. For example, one of them is kind of not really new. It's been around for 10, 15 years now, TMS, transmagnetic stimulation. It does help with, again, some patients, not all. Another treatment, I know it sounds really scary, but can be life-saving, is ECT. And it's not like what it used to look like in the movies. But you do go to a hospital to have that done under the care of a psychiatrist and anesthesiologist. And that's really, we use it for very severe cases of depression that are not responding to medication, or even psychiatric emergencies. Sometimes another type of treatment that is kind of newer is ketamine. Is kind of, people are starting to look, we're definitely looking more into that, but there's an intranasal form. And this is something that's a little bit newer too, that's kind of gaining some traction. I think for that one, you have to stay in the office for 2 hours afterwards. You have to monitor your vitals and things like that. But this is something else. It's kind of a form of ketamine, escalate, that is intranasal actually. So there's some other options as well.
People have limitations on maintaining their medication schedule because of fasting. What can people do in this kind of a scenario?
So definitely, again, reach out to your physician, because there's so many different types of medication and diagnoses, conditions, and also dosing schedules, and talk to your doctor about that. But that's a very good question, and it's really definitely something that needs to be addressed. Again, it kind of depends on the medication and what you're taking it for. If you're going to do worse, with fasting, then I personally think that kind of comes under health condition, a medical condition, that you might not be able to fast. Might be something to talk to definitely your doctor about, and maybe talk to the imam about too, if you really decompensate with fasting, not being able to take your medications on time, if it's really going to affect your ability, to function as an individual, as a mother, at work, at home, especially to the point where if somebody is decompensating to the point where they might need to be hospitalized or something like that. So that might take some serious conversations.
So a lot of people wonder, well, if I can take a pill, then why seek therapy? If it's something that can be a quick fix, why go through a longer process?
Something that I tell my patients is that there is no magic pill, there is no quick fix. So medication can definitely help with certain symptoms, but it's really, really important to stay in therapy. Actually, many psychiatrists, oftentimes the way that the clinics are set up is that their patients are referred to them by the therapist. So they're already in therapy, they have an established relationship, and only then can they even see the psychiatrist. The majority of studies that have looked at therapy alone, medication alone, and therapy and medication really look at the combination being really far superior to medication alone. And of course, the thing is that you don't need medication for everything. Majority of people that are going to see a therapist might not require therapy. Even the therapists that I have that refer patients to me, I think I don't know if the majority of their patients are to the point where they need medication necessarily. You're seeing a wider net probably. There's some that's they really don't meet any criteria at all. And then the more extreme that, yes, we definitely need to talk about medication. And then there's some that are in the middle, and I tell them, I say, I don't know if you necessarily need medication, but it could help. Usually the rule that we have is that, and this is actually really just for diagnosis, is it has to really cause some impairment in functioning to meet criteria for something like major depression or generalized anxiety disorder, or even ADHD. Everybody, it's not it's okay to not be able to pay attention all the time. We're not looking for perfection here. So you shouldn't really be looking to medication to kind of really make things perfect, I guess. And that should be something that should be addressed in therapy. What is that drive? And that's why therapy is so important, because you're working on examining yourself, doing a kind of a self-evaluation, also looking at kind of the thoughts that are contributing to depressed mood or to high anxiety states, or what are the kind of the things around you that are triggering panic attacks. These are really important. At the same time, there's therapists that will send me patients because they feel like the person is so anxious that they can't really utilize those coping skills that they're trying to teach in therapy, or they're so depressed that they're having a difficult time. They can't even get out of bed, they cannot function, they're not taking care of themselves, they're not eating properly. So yes, those are the cases where, we might need medication to kind of help us get out of that, but to maintain and to keep going, you need to have those skills that you would learn in therapy.
I know that there is genetic testing, which can provide a insight to the physician about how certain medications may be metabolized in the body for certain people, and it may help find a better fit of a certain type of medication that might work for someone.
This type of genetic testing has been out for a few years, and actually right now, from what I'm reading, is I feel like there was kind of a little bit more promise than kind of what panned out. So I do know some psychiatrists that utilize the testing. I have had patients that have requested it themselves, and we've done it. I wouldn't really recommend it for someone that's like has not really tried anything they want to see, because really majority of people are going to respond to kind of the first, like I said, the first kind of few things that we're going to try. So basically kind of I would say the jury's out on that. I feel like it is FDA approved, but I think it was a little bit quicker than faster than we would actually kind of see positive results from it, because that actually is also, it's a blood test, and it's basically looking at your level of enzymes, so how you are, level of enzymes in the liver. So all these medications work through specific enzymes, and do you have a high level or a low level? That's gonna help us say if you're gonna have side effects or if you're gonna be able to properly metabolize it. It doesn't necessarily say how the impact is going to be on a neurochemical level. I think that's kind of the biggest argument that I've been kind of reading about that. So it can kind of go both ways. Basically, I just feel like it's not really a quick fix necessarily as we maybe previously thought.
So thank you so much, Dr. Maru, for coming today and shedding light on this very important topic. I hope that people found this information to be beneficial.
Thank you so much again, Maliha, for doing this, for inviting me, for having, just being an amazing resource and bringing kind of these common questions and issues and topics to light. It's really important. And I just read a quote about how, of course, we know there's a stigma with getting help for mental health issues, for psychiatric issues. And because of that, there's a stigma with the treatment too. So the more we know, the better it is and the better we can do. So thank you so much for your role in helping educate others.
If you found this information to be helpful, make sure to share, like, and subscribe. I'll see you in the next one.